Hi, my name's Cannon Allen, and I'm going to be talking about situation monitoring. Attention to detail is one of the most important details. In this module, we'll introduce the concepts of situation monitoring, cross-monitoring, situation awareness, and shared mental models. We'll discuss the components of the STEP process to support situation monitoring, identify some strategies to help cultivate shared mental models among teams. We'll discuss the importance of when to share information, and recognize potential barriers to success and identify tools and strategies to overcome them. Review the following scenario while keeping in mind how well members of this team work together. A patient in the ICU is coded and CPR is in progress. The resuscitation team is busy ensuring that IV access is available and that the ET tube is inserted correctly. Dr. Matthews, the team leader, is calling out orders for drugs, x-rays, and labs. Judy, the nurse at the bedside, is inserting an IV. Nancy, another nurse, is drawing up medications. Judy can tell by Nancy's expressions that she did not get the last order called out by Dr. Matthews. Judy calls out while she continues placing the IV. Nancy, he wants the high-dose epi from the vial in the top drawer. Situation monitoring is a key component of the teamwork process, and it is intimately linked to the other three essential elements of teamwork. Because situation monitoring concerns the willingness and the ability to continually monitor a situation and share this awareness with fellow team members, it is enhanced by team leadership, given that team leaders encourage and role model supportive behavior. Situation monitoring allows mutual support through the ability to anticipate other team members' needs with accurate knowledge of their responsibilities. Situation monitoring is also moderated by communication, which allows for sharing of new and emerging information with other team members to retain a shared mental model. Continual monitoring of the situation enables the team to anticipate, predict the needs of patients and fellow teams, allowing the team to become more adaptive and flexible. That allows the team to recognize early and respond to deviations in plan, potential problems, and dangerous circumstances. Because of this vigilance, teams are better able to self-correct, compensate for fellow team members, and reallocate functions if necessary. Effective teams possess a shared understanding of the way that the process or plan should be carried out and established goals met, which allows teams to mitigate and correct errors before they occur or cause harm to a patient. The most important team outcome of knowledge is a shared mental model. The basic premise understanding of the relationship between shared mental models and teamwork is that the team effectiveness will improve if the team members have a shared understanding of the situation. We'll talk more about the situation monitoring and shared mental models in this module. Here's a continuum that begins with the individual skill of situation monitoring. The processing of monitored information results in the individual outcome of situation awareness. Sharing your situation awareness with fellow team members results in the team outcome of a shared mental model. Situation monitoring is the process of actively scanning and assessing elements of the situation to gain information or to maintain an accurate understanding of the situation in which the team functions. Situation monitoring is a skill which implies that it can be trained and developed as discussed earlier. Situation awareness is the state of knowing the conditions that affects one's work. It is a detailed picture of the situation. Note, situation awareness is not a static thing or concept. Because the situation and context in which the situation exists are dynamic and ever-changing, team members must continually assess relevant components of the situation and update their individual situational awareness. Shared mental models are the result of the team members maintaining his or her situation awareness and sharing relevant facts with the entire team. Doing so helps to ensure that everyone on the team is on the same page. A continuous process is necessary because of the dynamic situations in which teams function. It allows individual team members to maintain their situation awareness and share their new and emerging information with other team members to retain a shared mental model. Situation monitoring is the process of actively scanning behaviors and actions to assess elements of the situation or environment. Situation monitoring is a skill team members can acquire, practice, and improve on. It enables team members to identify potential issues or minor deviations early enough so that they can correct and handle them before they become a problem or pose harm to the patient. Mutual respect and team accountability are cultivated because situation monitoring provides a safety net for both the patient and team members. What are some of the ways that you monitor the situation in your unit or in your department? Some examples might be assessing the patient's conditions, noting malfunctioning equipment, and being aware of the workload of your area. Cross-monitoring is a safety net feature for the patient. It is the ability of the team members to monitor each other's task executions and provide immediate feedback. Mutual respect and team accountability is essential for the strategy of cross-monitoring to be successful among teams. This strategy is meant to help teams meet a collective goal: safe, effective patient care. Mutual performance monitoring is an important team competency. Cross-monitoring is used by fellow team members to help maintain situation awareness and prevent errors, commonly referred to as watching each other's backs. It is the action of monitoring the behavior of other team members by providing feedback and keeping track of fellow team members' behaviors to ensure that the procedures are being followed appropriately. It allows team members to self-correct their actions if necessary. Cross-monitoring is not a way to spy on other team members. Rather, it's a way of providing a safety net or error prevention mechanism for the team, ensuring that mistakes or oversights are caught early. When all members of the team trust the intention of the fellow team members, a strong sense of team orientation and a high degree of psychological safety results. Vigilance leads to self-corrections, which leads to error reduction. Self-correction is the process by which team members reflect on previous performance to improve future performance. In this cartoon, how might the team members cross-monitoring be beneficial to the patient and the team as a whole? It would alert the team members to the need to get a crash cart, check ICU availability, have respiratory therapy start O2. Staff members need to continually be aware of the situation, anticipate the next steps, watch each other's backs, and take appropriate self-corrective actions to prevent errors from reaching the patient. In this next video, let's watch how Dr. Pham prevents the possible medication error using cross-monitoring.
He wants to induce
What
labor with
actions
this
by
approach
the intern, Dr.
internationally.
Pham, were
I think he
a
wants 100
result of
micrograms.
cross-monitoring?
Actually, Dr. Dean, I see the order says
Direct and
25
immediate
micrograms,
feedback
Mr.
about the
Foster.
medication order,
Oh,
active
Right.
listening and
here's
participation in the
25
care
micrograms.
plan,
Good catch, Dr. Pham.
early detection of the team errors. How do you acquire a trained eye as you monitor the situation on your unit? What are relevant components of the situation that provide clues about impending complications or contingencies? The STEP process is a mnemonic tool that can help you monitor the situation and the overall environment. The STEP process involves ongoing monitoring of the status of the patient, team members, environment, and progress towards goal. An example would be the respiratory therapist notes that a ventilated patient is showing a marked increase in respiratory rate that might indicate an increased level of pain that cannot be communicated. Status. The patient's nurse is busy helping other patients. Team members. It is a shift change and everyone is busy, so you check the medication record and note the patient is overdue for his morphine. Environment. You notify the oncoming nurse of your concerns. Progress. In a healthcare setting, the most obvious element of the situation requiring constant monitoring is your patient's status. Even minor changes in the patient's vital signs may require dramatic changes in the team's actions and the urgency of its response. When assessing patient status, consider the following: patient history, vital signs, medications, physical exam, plan of care, and psychosocial conditions. Let's look at this next video to examine this further. Even though the patient's vital signs were normal, why did Greg have a reason for concern? The patient didn't seem herself or even aware of the current situation. You should also be aware of the team member's status to include the following: fatigue level, workload, task performance, skill level, and stress level. Healthcare providers are just as prone to human error as the general public. Teams that recognize and maintain an awareness of their individual team members' functioning are more likely to lend support or assistance. Observing the actions of fellow team members is a safety mechanism that can be used to mitigate errors before the patient is harmed. Awareness of your own condition to ensure that you are fit and ready to fulfill your duties is essential to delivering safe, quality care. Team members should assess and report if there is a personal situation affecting their ability to perform. I'm safe is a simple checklist that should be used daily or more frequently to determine both your coworkers and your own ability to perform safely. I'm safe stands for illness. Am I feeling so bad that I cannot perform my duties? Medication. Is the medication I'm taking affecting my ability to maintain situation awareness and perform my duties? Stress. Is there something such as a life event or situation at work that is detracting from my ability to focus and perform my duties? Alcohol, drugs. Is my use of alcohol or illicit drugs affecting me so that I cannot focus on the performance of my duties? Fatigue. The effects of fatigue should not be ignored. Team members should alert the team regarding their state of fatigue. An example would be, watch me a little closer today. I only had 3 hours of sleep last night. Eating and elimination. Has it been 6 hours since you've eaten or used the restroom? Many times we get so focused on ensuring that our patients' basic needs that we forget to take care of our own. Not taking care of our elimination needs affects our own ability to concentrate and stresses us psychologically. Teams should be encouraged to set goals concerning these items on their checklist. An example would be, everyone will be given an opportunity to take a break and have lunch today. The environment directly affects the quality of care delivered. Is the needed equipment present? Is there enough staff to tend to all the patients? The environment can change quickly and dramatically, and teams must be able to adapt to the dynamic nature of the situation. When assessing the environment, consider the following: facility information, administrative information, human resources, triage acuity, and equipment status. In reviewing progress towards goal, have you noticed a change that would provide a reason to modify the goal? By monitoring progress towards the team's established and agreed on goal, team members will be able to alert the team when strategies or the plan of care may need to be reconsidered or revised, or when additional resources are needed. When assessing progress, team members need to consider the following: status of the team's patient, goal of the team, tasks, actions completed or that need to be done, continued appropriateness of the plan. Goals were established and agreed on in the team meeting. What has changed and how does the goal have to be modified? Situation awareness is the state of knowing the conditions that affect one's work. It is the extent to which team members are aware of the following: status of a particular event, status of the team's patients, operational issues affecting the team, need to maintain mindfulness. The healthcare environment is dynamic, requiring team members to continually reassess situations to update their situation awareness. The result is a sense of knowing what's going on. A loss of situation awareness results in the following: ambiguity, confusion, and decreased communication. The success of high reliability organizations in managing the unexpected is due to their determined efforts to act mindfully. Strive to maintain an underlying style of mental functioning that is distinguished by continuous updating and a deepening of increasing plausible expectations of what the context is, what problems define it, and what remedies it contains. Below are some of the numerous barriers to maintaining situation awareness. They are the result of team members' failure to share information with others, request information from others, direct information to a specific team member, include patients or family in communication, utilize resources fully, example status board, automation, maintain documentation that is adequate, complete, and timely. A mental model is a mental picture or sketch of relevant facts and relationships defining an event, situation, or problem. When all members of the team share the same mental model, this is referred to as shared mental model. Sharing your situation awareness with fellow team members results in a shared mental model, or everybody being on the same page. Similar to the way that situation awareness is the result of individual team members' situation monitoring, a shared mental model is the result of each team member maintaining his or her situation awareness and sharing relevant facts with the entire team. In isolation, it is possible for an individual team member to misinterpret cues or to place too much emphasis on one piece of information. Shared mental models are knowledge structures of relevant facts and relationships about tasks or situations that the team is engaged in, and about the way that team members interact. Shared mental models enable team to anticipate and predict each other's needs, identify changes in team tasks, teammates, and adjust the course of action or strategies as needed. Shared mental models are sustained by the following: the process of planning, team decision-making, vocalizing. Research supports the notion that the ability to hold shared mental models is an important team competency. Shared mental models provide team members with a common understanding of who is responsible for what task and what the information requirements are. In turn, this allows them to anticipate one another's needs so that they can work in synchrony. On our continuum of situation monitoring, situation awareness, and shared mental model, where are these two groups? It's obvious they do not have a shared mental model. This picture also illustrates how a lack of a shared mental model can affect safety. Can you think of ways that the team will work more efficiently and effectively if all the members of the team are on the same page? If teams are better able to predict and anticipate, then the team will know what is supposed to happen. They will have a better understanding of how the case is progressing. How do shared mental models help teams? They lead to a mutual understanding of problems, goals, team strategies, patients' conditions, and plan of care. They lead to more effective communication to ensure that team members have the necessary information for task performance. They enable team members to back up and fill in for one another. They help team members understand each other's roles and how they interplay. They improve the ability of the individual team members to predict and anticipate the needs of the team. They create a commonality of effort and purpose. The most important, shared mental models help teams avoid errors that put patients at risk. Each team member has a unique perspective and information that benefits the team as a whole when shared. Different people view the same situation differently, but without sharing and communicating, each team member may have a different understanding. Look at these pictures. What do you see? The top picture on the left can be either viewed as an Indian or an Eskimo. Try looking from right to left and then left to right. That will help you sometimes see those two images. Below that in the center can be either a duck or a rabbit. The rabbit is looking off to the right and the duck is looking off to the left. The image on the right can be either viewed as an old lady or a young lady. They're both looking off to the left, but the ear of the young lady becomes the eye of the old lady. This picture helps illustrate how you can view things in different ways. If you're not communicating what you see, then we may not share the same mental model. There are both ad hoc and structured opportunities to share vital information with team members. Some examples of when information can be shared include team events such as briefs, huddles, and debriefs. It is important to establish the expectation that all these team events will occur and that all team members are empowered to speak up. Teams should communicate often and at the right time to ensure that fellow team members have the information they need to be able to contribute. This module discussed barriers that hinder team members from accurately monitoring situations that affect the care of the patient and effectiveness of the team. The tools and strategies introduced in this module to overcome these barriers include the following. STEP, a mnemonic template to help cue active monitoring of all the vital components of a situation. I'm Safe checklist, a list to prompt a self-status check. Cross-monitoring, or watching each other's back. Shared mental models and their impact on patient safety are the most important outcomes of situation awareness. Other benefits include the following. Adaptability. Having members who can back up and fill in for one another and easily adjust the plan of care as new information becomes available. Team orientation. Having members who understand each other's role and how they fit together. Mutual trust. Having members who trust other team members' intentions. By conducting situation monitoring, you are more likely to have a positive experience. You'll enjoy working as a team. You'll trust the teammates. You'll be better able to adapt and change and quick recover. And finally, your team will be safer and more likely to identify and correct errors. Teamwork actions can include the following. Conduct team exercises to increase situation monitoring skills, share information, include patient and/or family in communication, use cross-monitoring, apply the STEP process when monitoring the situation, foster communication to ensure a shared mental model among all team members, and share information during team events, briefs, huddles, debriefs, and transitions in care.